Haitian migrant repatriations put on hold, an early morning multi-million-dollar drug bust here in the capital, and ministers touring their ministries. Good evening, everyone. I'm Jcn with your Jcn News for this Thursday, September 30th. Thanks for staying with us. Repatriation exercises for the influx of Haitian migrants have been placed on hold as the Haitian government has communicated that the impoverished island nations facing some serious technical issues at the airport in Port-de-Paix. We get this latest from Immigration Minister Keith Bell.
As it stands now, I've spoken with the Honorable Fred Mitchell. From all indications, the Haitian government has indicated that they're having some serious technical issues with the airport in Port-de-Paix, and therefore we were unable to commence repatriation this morning. However, despite that, we anticipate that we will be able to repatriate all those that are being tried by Saturday. We will commence the repatriation exercise no later than tomorrow. If we get word from the Haitian government that I think that you're going to use an alternative airport, if that gets sorted out today, then we will do that today. There are, as you would recall, we had 501 initially there in Inagua. We had 414 on the quay. That number is a bit fluid because we know that there was less than anticipated on the quay. I think the number was at 377, if I'm not mistaken, and then added to the 137.
Minister Bell indicating that the national flag carrier has made 2 aircrafts available, adding that all law enforcement agencies are also on standby to assist with repatriation exercises when they resume. Residents on Inagua have expressed concerns about possible COVID-19 outbreaks from this influx of migrants, mainly because just 0.2% of Haiti's population is vaccinated.
The primary concern always remains that of ensuring that there are no disease, not only COVID-19. We've always had an issue with ensuring that tuberculosis and other diseases are not brought into the country by these groups of migrants. And so this isn't something new. Let me make that very clear in terms of testing. This is something that is always done. It is standard procedure. I commend the Minister of Health and his team in health. They have flown in a very large, a good-sized health team. They have continued with the testing. The first group was tested, the second group was tested, and this latest group, as you know, they are on their way into Inagua. They will be tested as well. And so, as I indicated before, there is no indication that there is any COVID among that group. That is my information.
Asked where the migrants are being housed, Minister Bell shared this.
What we're doing is, remember now, we have the facility at the Universal Declaration Church. That is where the initial group is being housed. The second group is being housed, the ones that were at the police station, they're being housed in an auditorium that was made available to us, a very new facility. They're being housed there. The new group that is out to sea, we anticipate that by the time as we start repatriation exercises, one of those halls will become available to us. So we anticipate that there will be no overflow or there will be no issue in terms of crowding, feeding, shelter, etc.
The minister says that out of the group of migrants in custody, 70 to 80% are males, 25% are females, and the remainder are children. Meantime, the Royal Bahamas Defense Force intercepting another Haitian vessel sailing off Ragged Island Wednesday morning. We're told that the Operations Communications Center at the Coral Harbor Base, on receipt of intelligence reports from Operations Bahamas Turks and Caicos, or OPBAT, dispatched a RBDF surveillance aircraft who confirmed shortly before 11 a.m. that a Haitian sloop was seen 24 miles east of Ragged Island, and HMBS Lawrence Major and Lignum Vitae were dispatched to intercept. Upon arrival, the team discovered that the Haitian migrants on the vessel, 137 of them, were removed from the vessel. These individuals will be taken to Matthew Town, Inagua, to be handed over to immigration officials for further processing. These migrants will join the 423 migrants housed on the island. Of this total, 287 are being held at a church hall and 144 at the newly acquired warehouse. 292 migrants were also removed from Flamingo Key and adjacent keys in the Ragged Island chain on Tuesday after their vessel became disabled. These individuals are currently aboard HMBS Lawrence Major. HMBS Lawrence Major will proceed to Matthewtown, Inagua with a total of 429 migrants and one deceased Haitian migrant on board. RBDF officials in a statement issued last evening say the group also has medical and food supplies along with additional security detail to render assistance. Shifting gears, the Atlantis resort plans to require its employees to be vaccinated or risk paying for weekly rapid antigen tests. But that's not sitting well with the president of the Bahamas Hotel Catering and Allied Workers Union president. Leah Cooper has more.
Atlantis planned to require all employees who are not vaccinated to pay for their own weekly rapid antigen tests as of tomorrow. We learned this much from the resort's president and managing director, Audrey Oswell, who advised employees in a statement that weekly tests would have been at a cost of $16.50. Well, president of the Bahamas Hotel Catering and Allied Workers Union, Darren Woods, begs to differ.
We don't believe that the employee should be paying for testing because the law presently doesn't require testing for employment, only for travel purposes. And the Health and Safety Act says that if the employer has a right, of course, to ensure that its property and its employees are safe. But it also says that if there's a cost associated with it, you shall not pass it on to the employees, okay? And so if they want the testing, they have to pay for it. And if they want it, they have to pay for it at the end of the day, or just ensure that the employees follow whatever the protocols are.
He adds that with this new requirement, a few questions need to be answered.
If you say to me that I'm required, it's mandatory for me to have this test done or to be vaccinated, are you saying if something happens to me, you're prepared to be liable? They don't want to go that far. They're saying that they want to join the other properties that are doing it. So you're also saying to me that if they're breaking the law, you're prepared to go along with them and break the law? If the regular employee or Joe Blow along the street breaks the law, they're hauled before the courts. So we expect for the law to be carried out because no employer, no one in this country is above the law.
Labor and Immigration Minister Keith Bell also told reporters today that he's since reached out to Labor Director Robert Farquharson, who has been in communication with Atlantis.
We have been able to convince Atlantis and the other private sector employers to hold off on implementing that policy. I have consulted with the Office of the Attorney General. I spoke with the Attorney General this morning to give us legal advice, and we will be guided by the advice of the Attorney General.
Last month, the mega resort launched a Vax for Cash incentive to encourage all of its team members to become fully vaccinated. The incentive offers cash prizes for Atlantis team members who take the approved AstraZeneca, Johnson & Johnson, Pfizer, or Moderna vaccine. Reporting for Jcn News, I'm Leah Cooper.
The Pan American Health Organization urging countries in the region to prepare for the next crisis by investing on the first layer of healthcare, that is the primary care sector. This coming from Director of PAHO, Dr. Carissa Etienne, during PAHO's weekly briefing on COVID-19.
Today, we have healthcare delivery networks that are mainly hospital-centric instead of being people and community-centered. They are focused on resource generation instead of health outcomes, on illness and disease instead of the holistic health and well-being of the individuals. This obviously has to change. To prepare for the next crisis, we need to focus instead on the first level of care, or what we call primary care. And we believe that 70% of health needs of the population can be successfully addressed at that level. And yet, financial investments at that first level of care remains minimal.
Dr. Etienne says she is convinced that countries need more healthcare financing, improved utilization of resources to address inequity, eliminating the need for out-of-pocket expenditure, and increasing efficiency within healthcare systems. She also makes a call for more investments.
In the same token, we need more investments in health research and to be able to apply scientific evidence in public policy making so that we make decisions that are based on the most current scientific knowledge. Most importantly, we need to build self-sufficiency so we can respond better to future health emergency needs when they occur. Investments in science, technology, and the industrial base in developing countries are essential for the future. And PAHO is working with member states on all of the above, ensuring that we can successfully confront this pandemic and bring it to an end, but at the same time, begin preparation for the future.
Dr. Etienne contends that it is not only important to prepare for the recovery phase of the COVID-19 pandemic, but also building stronger health systems and building capacity to address emergency care. You're watching JCN News. Stay with us.